Examination of the arterial system including digital ulceration and Raynaud syndrome. This is picture of our patient with ulceration of fingers. And question is, how would you work up this patient? What would you be your recommended examination? You must decide very quickly if you refer patient to the surgery department or if there is a need for urgent conservative treatment for this patient. And so what are the options of examination which are accessible in your clinic? Maybe you would choose as a first diagnostic options ultrasound. Maybe you will refer immediately patient to the angiography. Maybe you think that it's enough to only palpate peripheral pulse of the arteries to exclude some of the diseases of the arterial system. You can measure pressure on legs or hands. Maybe you can use oximeter with the plethysmographic record, or you can use capillaroscopy. What will be your first option in investigation of this patient? Let's speak about all these options, and we begin with the probably most used diagnostic method for the artery system, with the ultrasound. On this video you see typical pulsation of artery. This picture represents for non-sonographer what is the main purpose of the ultrasound examination. You see the artery with the narrowing of the flow in the middle of the picture, and for non-sonographer this represents very tight stenosis, maybe a stenosis of 50% of the artery. But unfortunately this is not true. Artery is three-dimensional structure, and if you will look only at the color record of the flow in the artery, you could sometimes be misled. In first two examples you see that atherosclerotic plaques obstruct the artery in the way which looks like there is a very tight stenosis. This is opposite to third case in which the ultrasound beam is going through the area of tight stenosis, but still it looks like there is no obstruction at all. So what is the conclusion from this slide? Unfortunately, even if this would be very elegant, simple to make diagnosis of the stenosis from the color Doppler, this is unfortunately not possible. So what is purpose of the ultrasound investigation? On the picture you see that there are two parts of the examination. One of them is again color flow Doppler, which is used only as a tool for visualization of the artery or vein. So you see, for example, change of the color of the flow in this area. The second part of the examination is measuring velocity of the flow. Now on the bottom part of the picture you can see sinusoid-like picture of the velocity of the blood particles. You are able to visualize the highest velocity of the bloodstream. True result of ultrasound investigation of the artery represents not the color record of the bloodstream but the velocity. And why is velocity of the bloodstream important from our clinical point of view? Picture shows the physics of the obliterated artery flow. What you can see here is change of the velocity of the bloodstream during occlusion. The change of the speed of the flow is related to the tightness of the stenosis. The bigger stenosis is, the higher velocity is the bloodstream. So if you imagine the starting velocity 60 centimeters in the artery, In the area of the stenosis, there is an increased speed of the flow of the erythrocytes to 240 centimeters in second. After the stenosis, there is again normalization of the flow and bloodstream slows almost to the previous level as the flow was before the stenosis. Please look that there is a change of the quality of the flow after the area of stenosis. So laminar flow is changed to the turbulent flow. As there is a direct relationship between speed and occlusion or stenosis, we can expect that there is a 75% stenosis of the artery in the case that there is a 4-time increase of the speed in comparison to the stenotic area. Picture shows the hemodynamics of the stenosis. You see that on the axis X there is a blood flow velocity, and the blood flow velocity slowly increase up to the 60% stenosis. Then there is a rapid increase of the speed. This area around 60% of stenosis of artery could be sometimes called, or it is called, critical stenosis. And why is it? The answer is, if you will look at the relationship between the flow and again the percentage of the stenosis. At the level of 60% of stenosis, regulatory mechanisms of the artery are not able to compensate the tighter stenosis than 60% of the artery. So this is the reason why the stenosis is called critical, and this is the reason why we are referring our patients with the stenosis about 60% in the area of the carotid artery to end arteriectomy. This slide represents practical demonstration of relationship of flow and velocity in artery with no obstruction or less than critical stenosis. We are demonstrating this situation with red area on the picture. Flow is stable and reach its maximum size. There is a very small increase of velocity up to 50% of diameter stenosis. Flow is completely laminar. You can compare previous slide with real situation with spraying the water from hose. Water leaves hose without obstruction. There is no thumb pressure at the end of hose. The bucket, which is representing flow here, is biggest, and stream goes in the middle of distance, here 1.5 meter. This slide represents practical demonstration of flow and velocity in artery with critical stenosis. We are demonstrating this situation with red area on the left picture. Flow is now decreasing and the velocity is rapidly increasing to deliver needed oxygen. Flow has changed to mixture of laminar flow, which is still useful and could be delivered to the needed area, and turbulent flow, which is now outside the mainstream. You can compare a slide of critical occlusion with real situation with spraying the water from hose. Water leaves hose with some thumb pressure at the end of hose. The bucket, which is representing flow here, is now only middle size. As flow decreases and stream goes to the farthest distance, 3 meters, which again represents the highest velocity of the stream. Some of the flow is lost as a turbulent flow outside mainstream. The last slide is representing physics of velocity and flow and shows high-grade stenosis or almost completely obstruction. We are demonstrating this situation with red area on picture. Flow is now minimal and lost its velocity. Flow is almost completely turbulent. You can compare complete obstruction with real situation with spraying the water from hose. Water leaves hose, now closed with maximum sump pressure at the end of hose. The bucket, which is now representing flow, is smallest and stream reaches only few centimeters from hose. Some water is sprayed reversely. Loss of flow is represented with smallest bucket. Velocity is lost in turbulent stream and almost all water drops at pipe end. In the previous picture, we explained the clinical reasoning for the measuring of the blood velocity as a main diagnostic tool for the diagnosis stenosis. So maybe for some of us this look like we solved the problem of the stenosis and arterial ischemia, but now we should look at some theoretical and maybe then practical problems. In previous slide we tried to show the importance of measuring flow velocity for grading the severity of stenosis. This principle is simple. The higher grade stenosis is present, the higher velocity is present. Unfortunately, the artery has not always only one stenotic area. The same loss of flow is seen in case of multiple partial occlusions. The change of quality of flow from laminar to turbulent flow will result in same loss of flow at pipe end. In this case you won't see typical change of velocity representing the expected result of ultrasound examination. Experienced sonographer will detect change of quality of flow from laminar to turbulent one, but the answer to the principal question, how much is flow deteriorated and what this represents for peripheral tissue, will be hidden. The multiple partial stenosis of artery will have a same catastrophic result as a complete isolated occlusion without typical ultrasound findings. It means increased velocity of flow. This slide represents the second problem with ultrasound examination in real life. There is a record of typical artery flow, but in the middle area there is a loss of flow. Why? Look in the arterial wall. You see white calcification which prevents the penetration of ultrasound wave to the artery. In this case, you won't be able to measure the velocity of bloodstream and you won't be able to recognize the severity of stenosis. Disadvantages of ultrasound for detection of peripheral artery disease. Ultrasound is unfortunately operator dependent. There is a limited use of ultrasound in our outpatient clinics. Ultrasound is time consuming and we have a limited access to some very important arteries. So we have problems in diagnosing of arteries in the aortic arch, in the pelvis, and generally smaller arteries. And you see only arteries up to the wrist and up to the ankle are visualized easily. Conclusion of ultrasound as a screening method for evaluating of arterial system. We would like to suggest that ultrasound examination is not preferred method for global evaluation of arterial system. Ultrasound is precise and preferable method only in case of isolated stenosis.